Good morning, Representative White. My name is Melissa Blizzard, and I'm a registered nurse and an advocate for improving access to health care through evidence-based nursing legislation. Thank you for taking the time to consider this important issue that impacts patients across North Carolina. Today, I want to speak with you about House Bill 218, known as the SAVE Act, Safe, Accessible, Value-Directed, and Evidence-Based Care. This bill is currently being reviewed by the Health Committee, and it has support from both sides of the aisle. If passed, the SAVE Act would remove the current requirements that advanced practice registered nurses, or APRNs, have a supervisory agreement with a physician in order to practice. This includes nurse practitioners, certified nurse midwives, and clinical nurse specialists, and nurse anesthetists. The goal of this legislation is simple: to allow APRNs to practice independently based on their education, training, and national certification. They would be able to diagnose, prescribe, and treat patients without needing physician oversight, just as they already are trained to do. As a practicing nurse, I've personally witnessed the barriers that these outdated supervision requirements create, especially in rural or underserved communities. I've seen patients wait unnecessarily for care simply because a physician was unavailable to sign off, even though a qualified nurse practitioner could have safely handled the situation. These kinds of delays are frustrating for providers and can be dangerous for patients. During the COVID-19 pandemic, many states, including North Carolina, temporarily lifted restrictions on APRN practice. A 2021 national survey conducted by Kleinpel and colleagues found that APRNs delivered safe and effective care under these emergency conditions without direct physician oversight. This demonstrated clearly that APRNs can practice independently while maintaining high standards of patient safety. Further support comes from the National Academy of Medicine, which in its 2022 report on the future of nursing 2020 through 2030 strongly advocated for full practice authority for APRNs. The report emphasized that removing practice restrictions helps close healthcare access gaps and improves healthcare equity, especially for vulnerable populations and rural communities. In addition, a study published by the Western Journal of Nursing Research by Patel and colleagues in 2019 found that states with full practice authority for nurse practitioners saw improved access to primary care services, especially in areas that previously struggled with provider shortages. This shows that removing restrictions not only expands access, but also helps alleviate pressure on the entire healthcare system. Now, I recognize that some people worry about patient safety without physician oversight. However, more than half the states in the U.S. already allow APRNs to practice independently. There is no credible evidence that patient outcomes were worse in those states. In fact, they often see better access, lower costs, and equal or higher quality care. Representative White, your background as a nurse and your leadership in health policy make you uniquely positioned to understand the value APRNs bring to our healthcare system. By supporting House Bill 218, the SAVE Act, you can help modernize North Carolina's approach to healthcare delivery, reduce unnecessary barriers, and make sure patients get the timely care they need from qualified providers. In conclusion, I urge your support of House Bill 218, the SAVE Act. This bill is safe, evidence-based, and vital for expanding access to care throughout North Carolina. Thank you again for your time and for your continued advocacy on behalf of nurses and the patients that we serve.